Welcome back to the Delta News Morning. Well, this morning we're talking health with Greenville-LaFleur Hospital, and we have a special guest, the General Surgeon, Dr. John Lucas. Good morning, Dr. Lucas.
Good morning.
Dr. Lucas, you're here with us this morning because one of your specialties involves a very part of the body that's important to all of us. It's the kidneys. It filters everything for us. But there are so many times and a lot of people that deal with those particular organs that fail. Can we talk this morning about renal disease and renal failure? Would you just kind of tell us what renal disease is?
Right. Your kidneys do filter out the waste products and they get rid of extra fluid, and when they don't work, it's a dire consequence. You can't live without your kidneys.
How folks that are maybe dealing with these issues or maybe worried about it, how do people make sure that their kidneys stay healthy and prevent certain diseases that could come upon them?
They need to have regular checkups, and the two major reasons for renal disease is diabetes and hypertension. So you need to have your blood glucose checked and your blood pressure checked on a regular basis.
Now a lot of the patients that you see, what is it is there something specific about those people that develop these diseases more so than others?
African American population is much more prone to develop diabetes and hypertension, and therefore it's about 5 times more prevalent to have renal failure compared to Caucasians. So that group definitely needs to be checked more often.
And what does a check consist of? When you say come in and get checked, what does that mean?
Well, I think people need regular health checkups, and that includes checking your blood sugar to see if you have diabetes and checking your blood pressure, whether that's at a sports physical or other kind of routine health visit.
And typically that way you make the adjustment beforehand and help your kidneys.
So not everyone who has diabetes or hypertension develops renal failure. If you control your blood sugar and you control your hypertension with medications or diet, then you won't develop renal failure.
Now let's talk about this. What if somebody does have their kidneys fail? What are their options that they take after that?
Well, if your kidneys fail, you can get a transplant. You can go on dialysis, where your blood is taken out of your body, filtered through a machine, and given back to you 3 days a week, or you die.
Definitely don't want to do that last one, no doubt. When we talk about organ donation, which we're just talking about, how important is it that people who are healthy are organ donors?
If you have renal failure, by far the best lifestyle is having a renal transplant. The waiting list is between 2 and 3 years for patients who have renal failure. And so for those 2 or 3 years, you have to be on dialysis if there's no donor available.
And this is something you specialize in. And as you're a general surgeon with the Lucas Surgical Group at Greenville-LaFleur, but how does your practice different from others?
We, about 80% of my practice involves creating dialysis access so that the nurses can draw off a pint of blood a minute from a patient, filter it through a machine, and give it back to them continuously for 3.5 hours. Wow. So it's taking an artery and a vein and sewing it together and allowing it to grow.
That's absolutely amazing. It's, technology and science has allowed us to come so far, really and truly. It's just now listening to those good advice we get, right?
Correct.
Leaving with us and finishing off this morning, if folks want more information about what it is that you do and maybe how to take care of their bodies a little better, what do you suggest they do?
Well, I think they ought to contact their family medicine doctor or their primary care physician and talk to them. And please avail yourself of the free screenings and other things for getting your blood pressure checked, and always take your medicine and keep track of your blood sugar.
And thank you so much, Dr. Lucas. Now, if you'd like to find out more about Dr. Lucas, you can do that at glh.org. That's for the Greenville-LaFleur Hospital. He's with the Lucas Surgical Group. And thanks again for being here this morning. And make sure we all stay a little bit healthier.
Thank you.
Stay with us. Coming up after the break, we've got that answer to trivia. We'll be right back.